What if I told you there was a way to reduce your blood pressure naturally, increase the strength of your muscles, and aid with injury rehabilitation? Well, sounds too good to be true, right? Particularly if I said it doesn't involve going to the gym and not really moving that much either. But today we're going to be diving into the effects of isometric exercise, which might be a game changer in your fitness routine, particularly if you're over 40 and struggling with high blood pressure. Now, you've probably heard of isometric exercises in things like the plank or wall sits, but did you know they're more effective than aerobic exercise in reducing blood pressure? That's right, a recent study found that wall sits were more effective at reducing systolic and diastolic blood pressure than conventional exercise. But that's not all. They can also help alleviate tendon pain and strengthen muscles too. Again, particularly if you're getting a bit older. But before you jump in, there's a few things that you need to know to get the most out of these isometric exercises, work your muscles, and to help reduce your blood pressure. Plus, I'm going to share with you along the way 10 different isometric exercises that you can use at home or wherever you are. So what are isometric exercises? Well, they're a form of strength exercise where your muscle doesn't move. It involves holding a static position so your muscle isn't lengthening or contracting. And you might recognize these with things like plank or wall sits. They're quite simple exercises. They don't involve that kind of movement, no jumping, no pushing, nothing high impact, so you're saving your joints a lot of wear and tear. But whilst they may be simple to perform, their benefits can be great on our health. So let's kick off with the first major benefit, and that's lowering blood pressure naturally. A study out in the British Journal of Sports Medicine looked back over 30 years. 270 different studies involving more than 16,000 people with or without heart conditions. And they tested the effects of 5 common exercise strategies to see what effect that had on their blood pressure. So they looked at aerobic exercise, that's things like swimming or jogging. They looked at resistance training, like weightlifting. They looked at combined aerobic and resistance training. Then they looked at high intensity interval training, things like sprints. And lastly, they looked at isometric training, things like those wall sits. And whilst they found that all forms of exercise had a beneficial effect on blood pressure, it was actually the isometric exercises that had the greatest impact. Now, this is a game changer for anybody over 40 who's looking to manage hypertension naturally. You see, isometric exercises work by dilating the blood vessels, which helps manage blood pressure over time. You see, they place tension on the muscles for the period of time whilst you're holding. And then when you let off, it relaxes, blood flow increases, which is part of the benefits on our vascular system. But you must remember to breathe throughout it. But that's just one of the benefits. See, another one is improved muscle strength and endurance, because when you're holding that isometric position, your muscles are engaged, meaning that you're building strength, whilst minimizing the wear and tear that you might have on your tendons and joints with traditional resistance training. And studies have shown that there is high levels of muscle activation when doing isometric training, meaning that you're building muscle strength, which helps protect our longevity as we age. And lastly, they are great for injury recovery. See, isometric holds are a go-to in physical therapy because they're low impact and controlled. They allow you to work your muscle effectively without creating additional stress, which means they are great for rehabilitation. And they can be really beneficial for tendonitis too. I've used them in the past myself, suffering from tendonitis in both knees whilst powerlifting. And studies have shown that they can reduce tendon pain, increase muscle function, and decrease tendon stiffness too. Now, whilst isometric exercises are certainly good, they do have a couple of drawbacks. Firstly is that you're only working the muscle in that one angle. so your strength gains are likely only around the joint angle that you're holding the position in, likely not as effective as full rep movements in resistance training. Now, the good news is that you can overcome this slightly by using different angles whilst you're doing your isometric training. And the other drawback is that they don't elevate your heart rate as much as aerobic exercise or resistance training. And that is a big factor in overall health and well-being. So I would recommend, unless you're using them as part of rehabilitation or to solely decrease your blood pressure, to incorporate them as a mix of other training styles so you're getting the best of benefits from each type. So now let's look into the remaining isometric exercises that you can add into your routine at home, at the gym, or wherever you are. Now, the first exercise is an isometric hand grip one. What you want to get is a small ball, maybe this kind of size, softer or a bit harder, maybe it could be a cricket ball, and you want to hold it as hard as you can. Grip it and squeeze. Holding it there, tight squeeze for 2 minutes, and then relax. Change to the other side and then back 4 times over. Next up is the wall sits. So for this, you want to position yourself against a wall. Slide your back down the wall slowly until your legs come into a position where your thighs are parallel with the floor. And you want to hold that for 2 minutes. You're gonna feel a burn, and then repeat 4 times over. This is a great exercise because it hits your quads, your hamstrings, your glutes, and your calves. And if you can't manage the wall sit, it's not a problem. Try this one instead. Put your feet up against a sturdy object or a wall, hands behind you, and just push through your leg, building that tension up and holding it there. Again, ideally for 2 minutes and 4 repeats. Next up is the isometric hamstring curl. So for this one, you want to prop your legs up on something a little bit higher, and then you're going to squeeze through the hamstrings here, digging your ankles in, just slightly lifting up off the floor, and you'll feel the hamstrings tense. Hold that position, again, 2 minutes, 4 times over. So this is an isometric wall push. You want to stand about a foot away from a wall and then push for 10, maybe 20, even 30 seconds through your arms, feeling the tension on your shoulders, triceps, and chest. Next up is the plank, the classic core cruncher. Keep this position locked in, holding for as long as you can, and repeat 2 to 3 times over. Keeping in a similar position, this is the isometric press up. Lower yourself down into the bottom part of a press up and hold the position there for 15 to 30 seconds. A great way to build upper body strength with minimal movement too. Here's the isometric Superman, laying on your stomach, arms and legs raised like you're flying through the air. Hold this one for 20 to 30 seconds. It's great for your lower back. Once you've mastered the wall squat, you can give this one a try, an isometric lunge. Holding that lunge position, leg parallel to the floor, and keep it there for 20 to 30 seconds before swapping to your other leg, having a rest, and then back on again to the same leg, 2 to 3 times over. And the last exercise is the isometric chest hold, which is great for your pecs. For this one, hands out in front of you, and you're pushing them together as hard as you can, squeezing it in. In 20 to 30 seconds, you'll really feel the burn on your pecs. And then release a few times over, and that's it. So that's it for today. Now, whilst isometric exercises can be incredibly effective for reducing blood pressure, I would always say, as far as possible, to try to incorporate them as a part of a balanced exercise routine, with some aerobic training, some resistance training, a bit of balance and flexibility, and some high intensity training if you can. And if you do have any specific heart conditions or been diagnosed with hypertension, it's best to speak to your doctor first before starting any exercise routine. So if you found this useful today, please give us a thumbs up and subscribe below for daily content on health and well-being optimization.